Are IUDs linked to infertility issues? Many people wonder if using an intrauterine device might affect their future ability to have children. The good news is that current scientific research shows IUDs are not directly linked to long-term infertility. When an IUD is removed, most women regain their fertility quickly, and their chances of conceiving are generally unaffected by prior use. Studies comparing women who have used IUDs with those who used other forms of contraception find no significant difference in the time it takes to become pregnant after removal. This applies to both copper IUDs and hormonal IUDs that releases levonorgestrel. Some older research suggested that long-term use of IUDs, especially in women who have never given birth, might be associated with a delay in fertility. However, these findings are less relevant today because IUD designs have improved, and better screening for infections is now standard practice. The main concern related to IUDs and infertility is the risk of pelvic inflammatory disease, or PID. PID is an infection of the reproductive organs that can damage the fallopian tubes and cause infertility. IUDs do not cause PID directly, but if an infection is introduced during insertion, or if a person has an untreated sexually transmitted infection like chlamydia or gonorrhea, the risk of PID increases. That's why screening for STDs before IUD placement is so important. It's also worth noting that if an IUD is left in place unnoticed or without proper medical follow-up, it can sometimes cause fertility issues. But these cases are rare, and removing the device usually restores fertility. IUDs do not impact ovarian function or egg quality, so they do not interfere with fertility treatments like egg freezing or in vitro fertilization. From a sexual health perspective, the link between IUDs and infertility mainly involves infection risks. Since sexually transmitted infections can lead to PID and infertility, screening and treating STDs before IUD insertion helps reduce this risk. Using an IUD does not increase the chance of catching an STD, but unprotected sex can. So, combining barrier methods with IUDs is a good way to stay protected. In summary, IUDs are a safe, effective, and reversible form of contraception that do not cause infertility for most users. The main concern is infection, which can be minimized with proper screening and follow-up. If you're considering an IUD, it's best to talk with a healthcare provider about your personal health history and reproductive plans. They can help ensure you choose the safest option for your needs.